name's Elaine Pauley. I am here with Nick Stover of our marketing department, and we're going to have a couple of really good stories to share with you today, particularly about a recent injury of Nick's, and then with his ACL and MCL, or just ACL and MCL, and then we're going to talk a little bit about plantar fasciitis. You can ask questions today, and my lovely assistant, Pat Zemer, would be happy to share those with you, or share those with us. So, Nick, tell us what happened. You've torn an ACL before, and then it happened again.
Yeah, I'm very lucky, I guess, in a way. I tore my right ACL about 4.5 years ago.
Okay.
And I played soccer all my life, was a college soccer player, was in a game doing everything normal, and got taken out from behind that time, completely unexpected. So went through rehab and everything, and this was long before I knew about MagnaWave or had met you.
Right.
So just did it all on my own and got it strong enough back up to a point where I was able to play soccer again, run marathons, play racquetball, have a really, really active life. And just, I guess, wow, it's been 3 weeks ago today. No, I'm sorry, it's been 5 weeks ago today when I tore it, I think. I was playing soccer again, and this time it was my left ACL. So I have a really good comparison of both legs and the treatments that I went through and the time that it took to kind of recover from each. This time I was again playing indoor soccer, same exact field, went in for a tackle, and someone kicked a ball at the exact same time that I did, and my knee basically went sideways, tore my ACL and MCL. I was lucky, I say, because I didn't tear any meniscus, I didn't tear any cartilage, and I should be able to have a full recovery. So with both injuries, it's really interesting because I have a great surgeon. He was able to look at where everything was on the MRI and determine that he could actually reattach my ACL.
Oh, wow.
So rather than giving me, people have heard of hamstrings or patellar tendons, cadavers, pig tendons. There's a lot of different ways that you can go about ACL repairs, but he could go in, find where the ACL detached, and see that it was still connected at one point. Sometimes it turns to like a pulp, and you can't do that, which is why you have to use these other tendons. But he grabbed it, pulled it through my knee, and sutured it off, basically.
Wow, that sounds painful.
It was a little painful waking up. First couple days were hard, but he did that with the ACL, and the MCL repair was very similar. It was detached and completely off hinge, and he was able to repair that as well. So
okay, so let's talk about, you did the injury 5 weeks ago. Is that what you said?
I think so now, yeah.
Okay, wow, it doesn't seem like that long. Okay, so 5 weeks ago, and I saw you the next day.
Yep.
And you were up and you were walking. So tell me a little bit about the ACL. When you tear your ACL, you're able to, like, in my mind, I'm thinking, okay, you're done. Like, you can't stand up, you can't do these things. But you were able to walk around, but with little to minimal pain. But it did hurt in some movement. So tell me a little bit about that.
So let's talk about the process of ACL injuries a little bit, and then lead into how I think MagnaWave helped me a lot more this time. So when I tore my first ACL, I was very scared. I didn't know that it was an ACL. I didn't know necessarily what it felt like, although it was pretty incredible pain. I went down right away. I knew that something was torn in my knee.
Mm-hmm.
So I thought it was an ACL based on what other people had told me, but wasn't entirely sure. And probably for about a week or two, I had a terrible limp. And just getting around from events, I was on my feet a lot with my job at the time. I had to sit on the floor, I had to stand up. I was doing some photography, video, social media, a lot of different things. But it hurt badly and really affected my job and my life, and it was a big pain.
Right.
For a lot of reasons. This time, when I tore my left knee, I knew exactly what it was right away. I called my wife and said I tore my ACL, within 30 minutes of doing it.
Wow.
And it hurt badly, but like you said, I saw you the next day, and I started MagnaWaving within probably 14 hours of my injury.
Okay.
And the pain wasn't there. And it should have been, I think, because not only did I tear my ACL, I tore my MCL, which means I should have had very little stability. I should have been a lot more careful walking around probably, but I didn't know that at the time. The day after, it took a while to get the MRI and everything, but I started MagnaWaving probably 15 to 30 minutes a day at least, and I was amazed because I was normal.
Yeah.
You know, between injury and surgery, I had a 2-week waiting period this time around, and I felt great.
Yeah,
I was hopping up and down on my leg. I felt like I could jog. I was working out, you know, every day at the gym, trying to stay in shape since I couldn't
So what
run.
machine did you use?
This one.
This one,
the Maya. Yeah.
What intensity? So you actually treated really low. You in the beginning, because of the sensitivity of the injury. A lot of times you may get the idea that you need to treat extreme, like these injuries, hard and fast. That's a really big misnomer in this with MagnaWave. A lot of times is that stronger isn't always better. The high intensity that our machines is fantastic, and it penetrates all the way through, even at a lower setting. So you were at what would you say the number was on the dial in the beginning, pre-surgery?
Well, when I started, again, this was really my first experience treating myself with a big injury. So, you know, I was a little nervous because I've heard you guys talk about how sometimes you overdo it. So I started at maybe 2, 3 for the first couple treatments, worked my way up to 5, 6, and then I got more and more aggressive and started turning it all the way up. And I could feel where my MCL was twitching, or at least I thought it was twitching.
Yeah.
You know, I could feel it hitting that spot. So I really kind of moved this around and could see, of course, where my knee would jump.
And you used the butterfly loop.
I did, yeah.
So you place the butterfly loop. It's a lot of times we call this a joint coil, and this actually has 2 separate magnetic fields, one on this side, one on this side. And when you put it over the knee, let's pretend like my elbow, you're penetrating all the way through the area. So like he said, whenever you could feel it in those, it's kind of amazing. We always joke in my family, like, how do it know? How do it know where your body can actually, it finds areas of sensitivity. The machine finds exactly where the sensitivity is, and that's what you noticed with your MCL. Did it actually move on the outside more?
Oh, yeah.
Really?
It was really easy to tell. I felt it before I could see it.
Okay.
You know, and as I turned up the intensity, I got to the point before surgery where I had that baby cranked all the way up.
And it felt good.
Felt great.
So everybody's different. He started low in the beginning, did exactly what you should do with this type of injury, is start low, build up into a comfortable setting for you. So tell us a little bit about you. Well, first of all, I want to say, if you have questions when we're done here with Nick, you want to ask questions about his recovery or anything to do with the machines, ACL, MCL, you could call 502-599-9722. Again, 502-599-9722 if you want to call in and ask us a question. Okay, and you can also post in the chat box as well, and Pat, my lovely assistant, will ask us those questions. Okay, so let's get back. You had surgery. How long ago did you have surgery?
Well, one more thing before surgery that I think is really interesting. So my process was a lot shorter this time to get to surgery. And I have a really good feeling, again, comparing this injury to last, that this helped reduce the swelling that was in there. And that's really important. You can't do the rehab that they need you to if all that swelling and pain is there. You know, you have to get some of the swelling out, and you have to keep your quads strong enough so that they don't atrophy. Okay. And if you have that pain, one, you don't want to use them as much. You're really careful babying that joint. And I was doing leg lifts right after my first MagnaWave treatment. I went to the gym that day and was getting back so that I could exercise my quads because they have to be strong enough in order to do the repair and suture and everything.
Wow. And
that really helped remove the swelling. So it helped me on the rehab to get ready. I think my time between injury and surgery the first time was about a month.
Okay.
And my time this time was only 2 weeks. And again, my quality of life improved immensely this time because I was so much more mobile. The other interesting thing is that the doctor, the surgeon himself, wasn't even sure that I had torn my MCL. A lot of people don't have great insurance. I'm really blessed that I was able to go through this surgery twice. But many people tear their ACLs, never get them repaired, and over time, they just get used to it. They don't play soccer anymore, they don't play sports anymore.
Yeah.
They might be able to get back to running, but they change their life completely. But I've heard from people it takes years and years, and sometimes they experience bad pain, even decades down the road. Wow. And this would be a great other way to treat yourself if you didn't want to have to go through surgery. And here's why I believe that. Even with my ACL and MCL torn, the surgeon wasn't sure that my MCL was torn. The day before surgery was the first time I saw the surgeon personally. And they could tell on the MRI that the ACL was torn. They could tell that the MCL was probably torn, but they weren't sure to what degree. Mm-hmm. And there's 4 different degrees of MCL tear. He basically, put my knee in his hands and kind of felt how far it was bending. And he could tell that it was a little off, but he told me, hey, I think it's healing itself. We'll be fine. I probably won't need to do a repair on it.
Wow.
And I thought, great, all right, just ACL, this will be simple. But then, when I woke up after surgery, I had this big old brace on my knee.
Yeah.
And it kind of scared me because I didn't have that the first time. And I asked him, eventually, why do I have this brace? And he said, well, your MCL was completely torn off. I mean, it was bad. Really bad. And it shouldn't have been a question, but it had already started to heal. And I think that this probably had something to do with that healing process.
Yeah. Because it really does. Your body, if it has the ability to heal, the machine is going to let it do that faster. Yeah. So what would have taken a much longer time was happening much quicker. Yeah. But then you said 2 weeks, 3 weeks.
2 weeks between injury and surgery. Yep. Okay. So, and now I think I misspoke on the time. Sorry, I'm still taking painkillers and a little off. But I had 2 weeks between injury and surgery. My surgery was last week, a week ago yesterday. So I'm actually just 3 weeks out. And now we can get to your question, which is after surgery.
Yeah.
So surgery's always tough, of course. Being under anesthesia and everything. The first couple of days, I was a little nervous, and that might be important to bring up about using the machine right away.
Yeah.
So for me, I wanted to wait a couple of days, and I probably waited a little bit longer than I should have even to start MagnaWaving again. And why would someone want to wait after surgery to start MagnaWaving?
Well, the only time that you really want to wait is if you're still bleeding. So if you have some bleeding going on, you want to let the body begin that initial healing there. But other than that, with my C-section surgery, once I got home from the hospital, I treated 3 days after. I was home in 2 days. I treated the third day because I did a lot of sleeping. Yeah. That third day after, and I was great. So as long as you don't have any external bleeding, you're fine. But there's that nervousness right after surgery. You don't want to even touch it. You're like, I don't want to touch it. Don't look at it. I definitely don't want to put anything on it that may.
That was me.
That's definitely the feeling. But once you get started, you're like, oh my gosh, why haven't I been doing this the entire time? Yeah. So there really isn't a need unless it's still bleeding. Yeah.
And that's exactly what I went through. I think Pat has some pictures of my knee after surgery that you could put up, but it had swelled up to the size of like a cantaloupe. It was enormous.
Okay, so that picture's up right now. You can see it.
Yeah.
And then when you started treating, did that swelling go down?
Oh yeah, almost that day. And I've been going through rehab, and so there's a lot of different things that I'm doing. Of course, taking anti-inflammatories and painkillers, rehab. At rehab they had a different kind of machine. But you can see, with that second picture, kind of this side-by-side comparison over time and how it's improved a little. So I did get back into it probably, like you said, about 3 days later. I started having a little bit of confidence that, okay, the bleeding's gone, and I'm sure that I can start treating again. And I've started treating. When I started treating, it was almost like where I was before that we talked about, where the intensity, I turned way down, and I felt it in different places. Yeah. And it kind of confused me because I didn't feel it in my MCL anymore, and that's probably because they repaired it, they reattached it. Now I feel, at first, I felt it on the outside, where my incisions were, where some of I probably have 8 different holes in my knee right now, but where you actually cut in on the outer layers is where I felt it more, and I didn't have that before. Right. So that was kind of interesting. And then as I've turned it up more and more, I feel it in a completely different part of my knee, probably more so where my ACL is situated. And I've been turning it up slowly day after day to get more of a deeper kind of healing.
That's interesting because when you have those injuries on the outside of your skin, there's sensitivity there, and that's where you will feel it at that point because there is swelling anytime you cut into your body. So it definitely found those areas again. So you've continued treating. Are you treating every day?
Oh yeah, every day, twice a day if I can. Mornings are a little tough, but and I'm slowly getting back more and more strength. But every day I feel a little bit better, a little bit stronger. And now my problem is I'm concerned I feel almost too good. So I'll show you my brace here. Here's the issue is my MCL takes a little bit of time. Sorry, I'm going to put my foot in your face.
It's okay.
So your MCL takes a little bit of time to heal, and I need to wear this in case I get pushed, or in case I accidentally fall down, or in case I lose balance. I have a 100-pound German Shepherd dog. If he runs into me and I go the wrong direction, I don't want to re-injure. And so I need to wear this brace, but I'm finding more and more that when I take it off to do treatments or I shower and changing clothes, I forget to put it back on because it's starting to feel great and it's feeling stronger, and I can walk around without it if I don't need it.
Leave your brace on, but it's definitely that's wonderful that you feel better though.
Okay.
Yeah, and you can treat over the top of the brace. So you could treat through a cast, you could treat through any type of dressing, just to clear up some things too. If you have metal in your body, if you have a let's say they put a plate in of some type, you can also treat over that. Obviously, if you're ever uncomfortable, stop. I think we've talked about that before. And treat, start low and go up. But you could definitely treat over any type of brace or cast. So if you have any questions, you could call 502-599-9722. For me or Nick, you can ask those questions by calling in, or you could also ask in the chat box. Another thing, since we're kind of on the subject of talking about legs and feet, recently I started treating several people for plantar fasciitis. More than 3 million people in the United States are diagnosed with plantar fasciitis a year, and what I've noticed is that a lot of people come to me when they are desperate. They're getting shots, or their next thing is surgery. There's not a lot that you can do, and it's actually the swelling. Just like after Nick's surgery, it's the swelling of a band in the foot. And we've talked about this before, but MagnaWave helps your body get rid of that swelling naturally. So when you get rid of swelling, you get rid of pain. When you get rid of inflammation, you get rid of pain. So that's what plantar fasciitis is. It's the swelling that's causing the pain. And when we get rid of that, you're able to live your normal life. And a lot of people are doing the same thing after not getting an ACL repaired. They're living their lives unable to do a lot of the things like walk around. I treated a mother the other day. She has 2 kids. She's like, I don't play with them. I'm not going outside. My plantar fasciitis is so bad. And I convinced her on Facebook to come in and see me. I said, come on, please come see me. Like, I promise it will be worth your while. And she called me after her first treatment and said, I have never felt this good in a very long time. She was like, I feel like Superwoman today. So the way that I treat that, if you have a MagnaWave machine, you can use the semi all the way up to the max. You just use the butterfly coil or the Zoom paddle, which you could also use on your ACL tear or after surgery. And you could use either of these. I put the foot right inside, or I put the foot right on top. And I do the exact same thing. I either put this on top or put the foot right on top like this. And you can treat the signal actually comes out of both sides of this, so you can treat either way, like this or like this. And so I've been treating her. I've treated her 3 or 4 times, and besides her, I've treated probably 100 other people for this, and it really is amazing. After 2 or 3 treatments, they're already feeling better. Is it completely gone? No. And will she have to maintain getting some treatments here and there? Absolutely, but she's able to not get those shots. She's going to avoid having surgery, and that's huge. That's a really big tip, to be able to avoid having surgery, like Nick said with his ACL and MCL. Sometimes you can't have the surgery. Sometimes your insurance doesn't cover it. If that's the case, this is an option. Get on our website, go up to the top red yellow button, I think it says treatments right now, and find a practitioner near you if you are not already getting treatments or you don't already have a machine, because this is something that is affordable and something that you could start doing immediately, specifically for plantar fasciitis or any type of surgery. Do we have anybody asking any type of... All right.
One thing about that, Elaine, is sometimes people have to put off those surgeries too, right? I'm lucky that I don't have kids yet. I'm married, but I could set aside a couple weeks to recover and go through all of this. And some people can't, just because of work and life, and it's not the right time of year, or they have to wait a couple of years.
Right.
My wife's father is one of these people that he was taking care of his wife. She was going through cancer at one point, and he put off a lot of surgeries for a number of years. And he has plantar fasciitis, and he has bad knees. And the problem is, if you have pain in one joint, it can affect your entire body. So like for me with my ACL, my left knee is the one that I injured, but I had to put so much pressure on my right knee, especially after surgery. There was a couple times I was worried I was going to have to get surgery on my right knee.
Yeah, compensation.
It felt really weak. It felt awful. And after surgery, I started treating my right knee too, because I had to. I couldn't stand up. I couldn't walk anymore. There was one point where I was really, really nervous about it.
Yeah.
So I had to use this for 15, 20 minutes on other joints and problems as well.
That's awesome, because that's a really big thing, specifically with, I think, a lot of athletes, even horses, where they compensate on the other injury, and that's where, on the other leg, where opposite of the injury, because it does take on more. And there's swelling there whenever you're taking on more, when your body weight is shifting like that, and your other joints are taking more, there's swelling there, and that could cause pain as well. So yeah, just like Nick said, don't forget to treat your whole body. I mean, treat the other knee. Same happens with your back. You can get unaligned by walking and having trouble.
I was just thinking, I've gotten some terrible migraines after surgery. I've been
Really?
on painkillers and anesthesia, and just the stress of it all. You know, this week's my first week back to work full time after having surgery last Wednesday, and
Wow.
I've had some terrible, like, just strange headaches. You know, it's not like the normal kind of headache that I get, but it kind of starts in my neck and works its way up, and so I've started treating my shoulders a little bit too, and it helps immensely.
Yeah.
So that's the wonderful thing about this. I mean, it's a total body kind of package. Really helps with a lot of different problems that I've experienced through this.
Yeah, exactly. So if you have an issue, just try to treat it. Always, our practitioners are great. You know, they have a whole bunch of knowledge, and they can answer your questions. I'll show you how I treat migraines, or how I treat my head, just, you know, so you're aware. You can put the coil, like he said, on your neck. And then you can also place it directly on your head. You know, again, start very low when you're treating your head. You could put the zoom directly on your head as well. I also treat the bottom of my feet. So I treat my head and my neck and the bottom of my feet when I have a headache. And it's almost instantaneous, where after a few minutes of treatment, it just kind of like releases. It's like you have a tight headband, and then the headband's taken off. So if you suffer from headaches, this may be something that you haven't thought about before, but it definitely is something that you can treat with the machine. And again, we're talking drug-free relief here. You're not having to take medication. There's not a host of side effects that you're going to have to deal with to get rid of these everyday types of problems. If you have a question, again, you can call in at 502-599-9722. If you have questions about things that you can treat, you can go to our website, MagnaWave PEMF.com. You can also join the group on Facebook. It's MagnaWave. What's the name of the group?
MagnaWave International Education and Resources.
MagnaWave International Education and Resources. Go to MagnaWave PMF Corporate Facebook and ask to join that group. People are sharing all sorts of information in there. It's a great place to ask questions, interact with our practitioners, interact with us, and see, you know, if you think, wow, I don't know if I could treat my hand. A lot of people are treating arthritis. I don't know if I can treat this injury or that injury, or you have a specific surgery that you have coming up and you want to know, when should I start? That's a great place to go and ask those questions. Nick has been blogging his journey. You've had 3 or 4 blogs so far, and we're going to publish those on our website so that you can follow along. He's going to keep going and talking about how this injury compares to his other one, and how MagnaWave has played a role in that. That's great resources to read, keep up with. And then we're also going to post this video online for you to share. So if you want to, reference this again, you'll have it. I think that's about it. If we don't have any questions, nothing.
No other questions?
All right. So again, our next webinar is
Next week, marketing.
Nick and I will join you again, and we will talk marketing next Thursday at 11. So same time, same place. Come back. We're going to talk about growing your business, what services we offer, and we're going to ask your questions. So write them down now. Again, check on Nick's blog. It will be posted on MagnaWavePMF.com. Find a treatment. Click the yellow box at the top of our website and get a treatment if you haven't already, so you can find the closest certified practitioner near you. Are we good? No questions?
Well, Jerry Dreesen makes the comment, MagnaWave goes through it all versus ultrasound, TENS, muscle stem therapy. Don't travel deep and can't go through bones. Oh, we're talking about the other things.
Oh, okay. So MagnaWave does. It penetrates all the way through the bone. I think that's what Dr. Jerry Dreesen was mentioning here, is that you penetrate all the way into the bone marrow, and you don't have to take any clothes off to do that. It goes right through the cast, and that's something that most other therapies do not do. So if you have a bone injury, you can also treat those. Again, we're wrapping it up. Thank you for watching.
Dr. Dreesen also states that MagnaWave PMF is also a needleless stem cell therapy.
A needleless stem cell therapy. So We had a big discussion about stem cells at MagnaCon. We have a fantastic video talking about that we'll also post on the blog. If you have questions about how MagnaWave works with stem cells, we'd be happy to answer those in the group, or you can always call us. If you have any questions, our phone number is 502-742-7868. We are here 9 a.m. to 5 p.m. Eastern Standard Time, and we'd be happy to talk to you about the therapy and how you can use it for stem cells and everything in between. Thank you for watching. Nick, thank you for joining me.
Appreciate it. Thanks for having me.